Good afternoon, everyone, and thank you so much for waiting. I suppose you don't plan anything because nothing seems to go to plan. So again, it's been an excellent day so far, and I hope everyone has really enjoyed it. I hope to contribute to that with my research that I completed for my final year of my Masters in Applied Building Information Modelling and Management through TUD. I began my journey through TU in interior design, and after some time in the industry, I decided to go back to education like many others during COVID. It was a time of uncertainty, but I was confident that the conversation around BIM was becoming more prevalent in the industry as teams were working in tandem on digital platforms. Not to mention the lack of interior architects within the BIM sphere is very low, and hopefully will begin to improve over time. For my research, I investigated into how the adoption of BIM could facilitate health promotion within an oncology day ward. The inspiration from this topic came from my current practice in TOT architects who have a keen interest in healthcare design. And so I established a gap in the research to synthesise the relationship between healthcare and design and BIM to grasp an understanding of the benefits that one could benefit from another. I further refined the contextual setting of my research to an oncology department for its integral need to be an optimal space for patients and staff. Shown in the diagram are many parameters illustrated within a COG ecosystem to demonstrate the requirement for a holistic approach. Stakeholder input informs the information requirements that the design team are to conform to in order to create an optimal model to showcase health promotion that is carried out by either the industry reskilling or upskilling in their field to carry out a healthcare design that works through digital transformation for greater productivity, using a digital model to encapsulate how BIM technologies can be utilised. So what does that all mean? Well, it means that each parameter is a driving force behind a holistic approach for carrying out an optimal healthcare setting. Therefore, my research examines how the digital built environment can assist in supporting the psychological experience that patients have in ambulatory facilities. The objectives I set out for myself at the beginning of this research was to critically evaluate the literature and understand what it constitutes for an optimal setting within an oncology department. Secondly, I wanted to examine the current position of oncology departments and how people perceive them as they are in their original form. Establish if key indicators that are being mentioned in the literature are attainable in practice, and lastly, gain an understanding of indicators that professionals within their field believe to assist in creating an optimal setting. Established in the literature are 4 key concepts that assist in creating an optimal model. The literature has an extensive list, but 4 indicators that I've extracted were prominent in the literature and ones that I further investigated. The study of an oncology unit and its design is a topic that has become increasingly salient in recent years due to the societal shift towards patient-oriented healthcare design. Traditionally, a successful healthcare delivery project signified its effectiveness on functionality that often produced psychologically hard facilities. Therefore, 4 key indicators have been established with the assistance of technological advances in lieu of conventional design approaches. There is extensive literature on the following topics, but to briefly run through them will give a basis of the findings for my research that I will discuss in a few moments. Supportive design was a key indicator based on seamless studies by Roger Ulrich to emphasise the importance of the patient's presence in the built environment to encourage healing through stress reduction. Therefore, the complexity of a hospital environment and the salient architectural features it inhabits can leave a substantial impression on patients and their treatment progression. Salutogenic design follows on from Ulrich's supportive design theory to surpass the pathogenic concept of disease toward the promotion of health and well-being, therefore removing the idea of traditional healthcare setting that often fosters feelings of stress through sparsely decorated facilities and therefore conveying negative connotations to patients. Environmental psychology is very much user-centre orientated, characterising parameters such as privacy to cater for patient satisfaction. With the sensitivity that comes with a cancer diagnosis, it can be a highly stressful environment that must consider treatment-related vulnerabilities within its design to include for side effects like exhaustion, noise and temperature. Therefore, achieving supportive surroundings can increase the opportunity for social interaction or otherwise privacy when it becomes timely and warranted. As we are all aware, BIM has become a catalyst for greater productivity and agility while alleviating potential problems that may arise. Therefore, using BIM enables the modelling of information to assist stakeholders visualise the space and therefore eliminate any misunderstandings that may occur between the stakeholders and the design team, and furthermore alleviate the need for the stakeholder to have architectural understanding who may only be looking at 2D drawings to develop an oncology unit. With the complex needs of patients that are subject to change over time has led to heightened pressure on the built environment to support patients in both physical and psychosocial realms. Therefore, it is important that we as an industry upskill in advancing technologies and begin the conversation with a wider array of stakeholders and end users to grasp their desires. It is a largely unexplored field in determining what good design entails and means that future demands by users cannot be accurately depicted. The dialogical action research technique used in this study is abductive in its approach. At the beginning of the study, I had various observations on what might constitute for an optimal model, with no insight into how the likes of a breakout areas or patient privacy, for example, may assist patients within their environment. So to formulate the observations I extracted from the literature, I carried out a two-stage interview process. A group of 7 stakeholders were selected to collaborate in the study from various backgrounds, and unfortunately, due to the vulnerability of the study and at the time constraints that I had for the ethical clearance, patients were not chosen to participate. The iterative cycle began with me reflecting on how Oncology Day Awards are constructed and designed within Ireland. In doing so, the analysis came through the literature review, where I read an extensive number of papers to capture the essence of what health promoting factors that were being discussed. In order to share the information with participating stakeholders, I modelled an existing oncology treatment room through digital tools using Revit and rendering in Enscape. In parallel, I modelled the existing oncology day room using health promoting facilities that I established through the literature. This was to enable me to showcase the first model and capture the essence of what stakeholders felt was good and bad about it. The second model enabled me to showcase what the literature states and, going back to my objectives, whether it was attainable within their professional practice, and if not, why. So with the response from stakeholders, that enabled me to return and correlate their understanding of health promoting factors with the literature and design an optimal model. Therefore, through the third model, I repeated the iterative process, and in order to establish a consensus among stakeholders of what they believe to be a health promoting environment. Here we have the existing oncology treatment room, and based on the parameters I mentioned in the literature review, include supportive design, salutogenic design, and environmental psychology. These images portraying the existing room may not, and may to some, indicate that the environment could promote health healing through stress reduction. It is, from a salutogenic perspective, very much focused on the pathogenic aspect of healthcare that can foster feelings of stress through, as I mentioned, sparsely decorated facilities. The proposed treatment room now showcases more interest through patient-nurse capacity. The central nurses station has been removed to provide patients with a sense of security and the relief to know they're being monitored without being overlooked in an intrusive manner. The use of artwork stands out to avoid negative thoughts escalating for patients, and the use of glazed partitions enable the natural light to be emphasised within space and allowing a feeling of openness and belonging. This model was received well with stakeholders, and the comments received allowed me to produce a third model for the second round of the interview process. To qualify what the participating stakeholders believed to be of importance when designing an ambulatory facility, it was important to illustrate the list of parameters that were being mentioned during the first stage of the interview process. The blue line represents themes that were acknowledged by the interview participants, and the red line indicating themes that were introduced by myself based on what I read from the literature. This enabled me to establish what the participants that worked within the area of oncology believed to be of importance from their professional experience. And as you can see, many of them were captured twice, 3, 4 times over, and those include biofit design, spatial awareness, patient privacy, and staff-to-patient visibility, to name a few. Much like the previous slide, the second round of interviews followed the same analogy of what stakeholders constituted for an optimal environment, highlighting that positive distraction, patient privacy, and biophilic design, as well as spatial layout, to remain imperative to achieving a space to promote health and well-being for patients. The images presented here therefore capture the health promoting factors that professionals in industry believe to be of importance, and how. Well, firstly, biophilia was acknowledged for its approach to alleviate stress and lead to greater health outcomes. Therefore, it has been brought through the use of colour, artwork, and outdoor planting. With the current arrangement of chair beds, they are all positioned to maximise the view to patients, to capture salutogenic design within the space, and implementing glazed doors and partitioning to retain the concept of non-traditional hospital design to feel a sense of openness and access to the outdoors that I discussed previously. Spatial layout of each model was deliberated by each participant. While the spatial layout remained largely unchanged from the first and second revision of the model, the number of beds decreased from 19 chair beds to 12 chair beds. This was to include for 2 private en-suites to cater for the control of infections, wider bays to cater for nurses' lean processes, and family interaction. The concept of losing beds to cater for these necessary requirements was a turning point in the research, and 2 out of 7 participants queried how viable it would be to the hospital. The literature states that with a better environment, it can enhance a patient's recovery and therefore reduce their time in the hospital. However, one participant stated that as the turnover in patients and in turn revenue couldn't be guaranteed, it would be unable to accept an optimised environment for patients based on the revenue that they would lose out on. When referencing to the breakout area, the view was made that the space is a luxury and therefore it would be compromised for additional beds. Nevertheless, to optimise the environment for a patient, it was believed that the breakout area is essential in the assistance of their recovery and stress reduction. As challenges arise, patient privacy was considered to be imperative to patient satisfaction while also remaining flexible to navigate those who may want to socially interact. The communal area was considered important to allow patients who are able-bodied to utilise their time, whether that's to socially interact with others or sit independently, but away from their bay to maintain independence within the hospital environment. Positive distraction through the lens of salutogenic design could be looked upon through the use of colour and natural elements that were used alongside the loose furniture, wall and flooring finishings, and was believed to have influential tools to shift patients' thoughts and induce calming impressions on the environment. Therefore, artwork was perceived of importance, and the level of artwork of importance for the artwork that was selected was notable. One participant stated that while the artwork is a welcomed addition, the artwork must be thought-provoking, enabling the scene to elicit diverse emotions and ideas on each encounter, therefore reducing stress, enabling patient satisfaction, promoting health and well-being through salutogenic designs, which were 3 aspects that I touched on from the literature. So in conclusion, the application of BIM technology and its processes can be articulated to promote a psychological, supportive, ambulant cancer facility to improve patient experience. With the 4 constructs that were derived, it was notable that each one is important to optimisation of a treatment room. This is a patient-driven environment, and we as professionals within the construction and design industry have the ability to cater for supportive environments for patients, staff and their families with the use of digital transformation. Once we're motivated, we engage in early collaboration with stakeholders, and we have and enable the behaviours and processes necessary to carry out a successful project. So that concludes my research into how the adoption of BIM could facilitate health promotion within an Oncology Day Award. Thank you to everyone listening and for their time. I know there's a lot of interesting talks on at the moment, so your attention is very much appreciated. And if you have any further questions, my details are on the screen. Thank you.